ತಗೊಂಡ್ರೆ ಚಿಲ ಬಸ್ಸುದೆ ಕರಿ ಎಲ್ಲದನ ಇಲ್ಲ ಅದಕ್ಕೆ ಮ್ಯೂಟ್ ಮಾಡ್ಯಾರ ಇನ್ನ ಇಲ್ಲ ಸರ್ ಇನ್ನ ಇಲ್ಲ ಆಗ್ಬೇಕು ಅದಕ್ಕೆ ಇದು ಹಿಡಿಲ ಯಾರನ್ನ
Good afternoon to everyone. Myself, Dr. Rajesh Badar-Shetty, HOD Department of Rognidana, SUM-EMC. Family members of SUM-EMC, distinguished personalities who gathered here to share their respected Dr. Madhav Diggavi sir, Vaidya Rohini and Vidya madam also. I welcome all the doctors, students, internees and PG scholars. Now it's time to light the lamp. I request our beloved principal, Dr. K.C. Das sir, to light the lamp. Sir, please. Now I request our beloved principal sir, K.C. Das sir, Dr. K.C. Das sir, to say a few words about Madhava Manthan-2020. Sir, please.
Sri Guru Vasavallingaya Namah. My pranam to Sri Guru Mantra Swamiji, all my dear teaching staff members. Today I am extremely happy to announce that on behalf of the Rog Nidan department, they have started the Madhava Manthan, the national webinar series from 16/6/2020 to 25/6/2020, and in this connection, 10 research persons, very renowned research persons, have given their kind consent. So I am very much thankful to the HOD, Professor Dr. Rajesh Badar-Shetty, and the staff member Dr. Vidyasri, and the organizing secretary Dr. Manjula madam. I welcome to all the 10 dignitaries for this webinar series. They are Dr. Madhav Digavi, Professor and HOD Department of PG Studies, Taranath Government Ayurvedic Medical College, Ballari. Then Vaidya Rohini Sachin Gopal Das, Assistant Professor D.Y. Patil College of Ayurveda and Research Center, Pune. Dr. Ritu Sharma, Assistant Professor, Department of Rog Nidan, National Institute of Ayurveda, Jaipur. Dr. Ravi Shankar Parvaje, Consultant Surgeon, Sushrut Ayurveda Hospital, Puttur. Dr. Shalini Rai, Assistant Professor, Department of Rog Nidan, All India Institute of Ayurveda, New Delhi. Dr. Nikhil Chandra, Assistant Professor, Rajiv Gandhi Ayurvedic Medical College, Mahe. Dr. Sashikant Tiwari, Assistant Professor, Rishikul Campus, Uttarakhand Ayurveda University, Haridwar. Vaidya Madke Kuber Bhagyasri, Assistant Professor, D.Y. Patil College of Ayurveda, Pune. Dr. Priyadarshan Tiwari, Assistant Professor, Faculty of Ayurveda, IMS, BHU, Varanasi. Dr. Mallikarjun Dambar, BSc, BMS, founder of Atharva Institute of Ayurveda Research, Shimoga. So I welcome all of you, the 10 research persons for our webinar series. I am very much thankful to all of you as you have given your kind consent, and the students definitely will be motivated by your speech. So on behalf of the management, on behalf of all our teaching staff members, on behalf of all PG students, UG students, and non-teaching staff members, I welcome to all of you. And I hope all the success of this webinar series. Today, the guest speaker is Dr. Madhav Digavi, sir, Professor and HOD, Department of PG Studies in Kaya Chikiৎসা, Taranath Government Ayurvedic Medical College, Ballari. Sir, I welcome you, sir. My pranam, sir. I miss you this year, sir, due to this COVID-19. And every year you are coming, and the students were very happy. So this year also, I hope by your very good guest lecturer, definitely it will help for our students. Thank you, sir. Thank you. Thanks to all of you, all the 10 members, for your consent. Thank you.
Thank you very much, sir, for your valuable wordings and wishes. Now it's time to introduce our today's speaker. I request Dr. Vidyashri Madam to introduce today's eminent speaker, Dr. Madhav Digavi, sir. Madam, please.
Sorry. Sorry for the interpretation. Okay. Om Dhanvantaraye Namaha. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namaha. It's my immense pleasure to introduce my Guru, Dr. Madhav Diggavi sir, Professor and HOD of Department, PG Studies in Kaya Chikitsa, Taranath Government Ayurvedic Medical College, Ballari, who is a live example for Charaka Siddhanta Adharita practitioner in presented era. Sir has completed his UG in Ayurveda Mahavidyalaya, Hubli, KUD, Dharwad. Sir has completed his PG in IPGT and Arya Gujarat Ayurveda University, Jamnagar in 1998. Sir has more than 22 years of teaching experience. Sir has done research work on Vajikarna by Uttara Basti. Sir is a well-known practitioner because of his practice by treating more than 90,000 patients by Ayurveda only. Sir has presented 3 international and 10 national papers. Sir has given more number of guest lecturers and worked as a resource person in different national and international seminars. I request to all the participants to put the questions in the chat box. At the end of the session, it will be discussed. Now, I request Dr. Diggavi sir to continue the session, sir. Dr. Dhruv?
Hello.
Hello.
Hello. ಕೇಳಿಸ್ತಾ ಇದೆಯಾ? ಹಲೋ.
ಹಾ ಸರ್.
ಅಲ್ಲಿ ಧ್ರುವ ಸಾವಂತ್ರಿ ಅಂತ ಇದೆ ನೋಡಿ ಹೆಸರು, ಅದನ್ನ ಕೋಹೋಸ್ಟ್ ಮಾಡಿ. ಪಿಜಿ ಸ್ಕಾಲರ್ ಅಂತ ಇರುತ್ತೆ ನೋಡಿ ಮೇಲೆ.
ಸರಿ.
ಹಾ ಅದನ್ನ ಕೋಹೋಸ್ಟ್ ಮಾಡಿ, ಅವಾಗ ನಂದು ಸ್ಕ್ರೀನ್ ಮೇಲೆ
ಆಪ್ಷನ್ ಇಲ್ಲ ಅಂತ ಸರ್.
ಹಾ
ಕೋ ಹೋಸ್ಟ್ ಆಪ್ಷನ್ ಇಲ್ಲ ಅಂತೆ, ಹೋಸ್ಟ್ ಮಾಡೋದ ಸರ್?
ಹಾ ಮಾಡಿ ನೋ ಪ್ರಾಬ್ಲಮ್.
ಓಕೆ.
ಹೋಸ್ಟ್ ಮಾಡ್ತಾರೆ.
ಸರ್ ಆಗಿದೆ ಸರ್.
ಎಸ್.
ಓಕೆ.
ಪಿಪಿಟಿ ಕಾಣಿಸ್ತಾ ಇದೆಯಾ? Am I audible?
Yes sir, it's audible.
All of you mute. Ask all of you, all the delegates to mute.
Okay sir, I requesting all the participants, please mute your audio.
Okay. Let me start.
Yes
Shall I
sir.
start? Okay.
Yes, sir.
Ragadi rogan satatan shaktan aseshakaya prasrutan aseshan outsukya moha ratidan jaghana yo purva vaidyaya namustu tasmai. With great salutations to all legendaries of Ayurveda, Om Shri Charaka Sushrita Vagbhataya Namaha. Om Shri Dhanvantare Namaha. Most respected Guruji of the institute, the principal K.C. Das sir, head of the department of Roganidhana, Dr. Badra Shetty ji, all the teaching faculty members of Department of Roganidhana, dear PG scholars, delegates and friends. Welcome you all for a short discussion on understanding of diagnosis of hypothyroidism in Ayurvedic perspective. Today, let us have few lines of understanding of hypothyroidism and Ayurveda. It doesn't mean that we will cover A to Z of hypothyroidism because it is a vast field in endocrinology. Ayurvedic endocrinology is much understood with Kapha, Meda, Shleshma Vikaras, Ati Santarpanajanya Vikaras, Ashtav Nindita Vikaras, and so on. The Dhatwagni of particular Dhatu, when it is subnormal, will try to develop the next Dhatu's endocrine disorders. Esha Amsha Dhatushu Samsrita. If you go back to Charaka Samhita Chikitsa Sthana, Rasayana Pada, in the second chapter, third shloka, Acharya Charaka says, in ancient days, there were only two type of rishis were seen. One is Yayavara, another is Shalina group. Two types of rishis were there. When Yayavara means they were moving one place to another place, they were not having a fixed house. Shalina were having fixed house and started living. And later on, it was found that when Yayavara became Shalina and stick to a particular place, they started eating Gramya Ahara. And due to Gramya Ahara Sevina, Shitili Bhavanti Mamsani, they become very weak, they become dull, they started getting Shitila Mamsatvam, they started getting one by one diseases. Then they learned that we should not stay in one particular grama and Gramya Ahara will cause disease. And they went back to Himalaya to get a natural food and boarding and lodging. So the disease started initially because of change in the lifestyle, change in the food style, changing in the habitat. So this is the root cause for all diseases in the ancient time. So Gramya Ahara settled in a city continent and eating city food is going to cause disease, whereas staying in natural forest, eating and drinking the fresh available vegetables and fruits will not make any disease. Based on this, let us start understanding hypothyroidism in Ayurvedic purview. It is estimated that about 42 million people in India suffer from thyroid disease. There are congenital hypothyroidism and it is also acquired thyroidism. The prevalence of thyroidism, hypothyroidism is 3.9%. The second only to diabetes is the most common endocrine disorder is hypothyroidism. As per the middle age and elder age, the incidence rate of hypothyroidism increases. And it is seen that it is very common in female hormone. Females and female hormone are very common to get hypothyroidism. The term myxedema, formerly it was a synonym for hypothyroidism, refers to the appearance of the skin and subcutaneous tissues in the patient who is severely hypothyroid state. The endocrinological advancements have made us to understand hypothyroidism with different perspectives. The hypothyroidism is a big syndrome. It is a Vyadhi Lakshana Samuha. Vyadhi Samuhu Ekshma. The hypothyroidism, hypo means deficiency, thyroidism means thyroid hormone secretions. There is a generalized slowing down of metabolic process. See the beauty of Roganidana aspect of hypothyroidism. Kayasya antaragnehe chikitsa kaya chikitsa. Kayo nama agnihi tasya chikitsa kaya chikitsa. The slowing down of metabolic rate, BMR, basic metabolic rate decreases, and that is the main feature of hypothyroidism pathology. So Agni Mandya is one of the common condition to be understood with hypothyroidism. Tatvagni Mandya, Jataragni Mandya, Bhutagni Mandya, and even cellular Agni Mandya. So the metabolic process is decreased, means Shante Agno Mriyate. Acharya Charaka says in Chikitsa Sthana 15th chapter, if Agni is completely declined, person will die. Yukte Chiranjivati. If Agni is normal, the person will be Chiranjeevi. Rogi Syat Vikrute Moolam Agnis Tasman Niruchate. The person becomes Rogi when Agni becomes abnormal. Vikruta. Rogaha Sarvepi Mande Agno Sutaram Udaranicha. If when I was a student, if this shloka was told, people were not understanding. But now we are able to understand it. Rogaha Sarvepi Mande Agno. All diseases are due to the low metabolic process, especially Udaranicha. Udaranicha means Udara Guhasto Vyadihi Udara Vyadi. Udarasto Vyadihi Udara Vyadi. The diseases which are related to the organs of Udara Guha may be pancreas, stomach, esophagus last part, liver, hepatobiliary system, adrenal glands, kidneys, ovaries, uterus, intestines. All diseases of these organs are due to the hypometabolic state. So hypothyroidism is hypometabolic state disease. In newborn infants, hypothyroidism leads to cretinism, Vamanatvam, one of the Ashtav Ninditam. In adolescents, it will cause a short stature, mental retardation, and precocious puberty. This is psychosomatic aspect of hypothyroidism. The decreased metabolic rate also causes decreased mental activities, subnormal mind activities, short stature, kubjatvam, vamanatvam. In adults, the symptoms are largely reversible after therapy. Thyroid regulation, if you understand, hypothalamus releases TRH hormone, thyroid regulating hormone. Hypothalamus is brain. It is Mastishka Marma, Mahamarma. The thyroid regulatory hormone stimulates the anterior pituitary gland, and anterior pituitary releases thyroid stimulating hormone releasing factor. So thyroid gland will release T4 and T3. So plasma T4 and free circulating T4 or plasma T3 and free circulating T3 will reach the tissues. So FT4, free testosterone 4, is converted into triiodothyronine free or RT3. We should clearly understand that TSH is secreted by pituitary gland. In hypothyroidism, TSH is raised, T3 and T4 are decreased. So don't understand, the common man think that TSH is released from thyroid gland. It's not like that. The iodine and protein present in the blood will be binded in the presence of T3, and the T3 is triiodothyronine. It is converted into T4, and T3 is the active part of the thyroid hormone. T4 is large part of thyroid hormone. T4 is dependent on iodine and protein. Iodine dependent hormone is T4. So iodine metabolism is damaged. Iodine is lavana. Lavana is vataharam. And when lavana is not digested and metabolized by the body, it will cause hypothyroidism. When excessive lavana is there in the body, it will cause the thyroid dysfunction. When iodine storage in the body is decreased, then also hypothyroidism manifests. So proper supply of iodine and normal iodine metabolism is responsible for normal thyroid function. If iodine is available in the blood and protein is binding with that, then almost all 80% of the enzymatic activities in the body are controlled by thyroid hormone. If thyroid hormone is abnormal, 80% of the enzymatic activities of the body are damaged. There are following 5 steps in hormonogenesis. Ask someone to mute that. Mute it. Trapping of inorganic iodine from dietary iodides. We get iodine from dietary iodides. Activation of iodine to high valence iodine 2. This iodine 2 is incorporated into tyrosine of the thyroid globulin. The coupling of MIT and DIT to form T4 and T3. The proteolysis of thyroglobulin to release T4 and T3. This thyroglobulin is proteolyzed. This proteolysis is controlled by the brain enzymes. Thyroid hormone biosynthesis. In the plasma, iodine is there. It is entering into the thyroid follicular cell, and the colloid present in the thyroglobulin mixed with tyrosine and MIT or DIT, there will be development of T4. And T3 is converted, T4 is converted into T3 by lysosome. See, this T3 is again released into trypsin. So in the peripheral tissue, this trypsin is going to be acted in the enzymatic activity. If this cycle of thyroid follicular cell biosynthesis is abnormal, the metabolism is abnormal, Agni Vyapara is abnormal, then hypothyroidism starts. Monoiodotyrosine MIT, diiodotyrosine DIT, triiodothyronine T3. T3's half-life is very short. In 6 hours, T3 will be metabolized. Tetraiodothyronine T4, its half-life is 7 days more. The reverse T3 metabolically inactive. T4 is 99% protein bound to thyroid binding globulin, and T3 is 99.5% protein bound to thyroid globulin. The bound hormones are inactive, should not be measured. So what is binded with thyroglobulin is inactive. Free thyroid hormones, free T3, free F4, T4 are metabolically active. So if you have a doubt in diagnosis of hypothyroidism, T3, T4, TSH blood test is in front of you. If you have a doubt, then recheck with the FT3, FT4 and TSH. And if you have again a doubt, then do thyroid binding globulins. Anti-thyroid antibodies should be checked. And with one ultrasound scanning of the thyroid gland to rule out follicular enlargement, nodular enlargement of the thyroid gland, investigation is required. The thyroxines. T3 is 10% it is from thyroid gland, 90% derived from the conversion of T4 to T3. T4 is exclusively from the thyroid gland. 80% of the T4 is secreted, 20% of the hormone secreted is T3. And the liver is responsible for this T3, T4 secretion governance. So when liver is intermediary metabolism is damaged due to any liver diseases, due to the alcoholism, due to the fatty liver, or due to any other liver disorders, parenchymal liver diseases, the secretion of 80% of the T4 or 20% of the T3 is damaged. So diagnosis of thyroid hormone is one from the pituitary hypothalamus, another from the liver, another from the blood. So Rakta Dhatu is the prime Dhatu for thyroid hormone, and thyroid hormones are circulating in the Rasa Rakta. So Rasa Rakta Dhatu Vruddhi Kshaya Lakshanas are responsible for giving a clue for hypothyroidism. And as per Ayurveda, in the Raktavaha Sira only Vatavaha, Pittavaha, Kapavaha, 3 Siras are present. So Vatavruddhi, Pittavruddhi, Kapavruddhi in Vatavaha Sira, Pittavaha Sira, Kapavaha Sira is going to give hypothyroidism manifestations. The diagnosis of hypothyroidism starts with the Raktava Sroto Mula liver, the Rasava Sroto Mula Hrudaya, and Shiromarma. Hypothyroidism causes are primary and secondary, tertiary. The basic thyroid gland failure is one of the cause for hypothyroidism. The allopathy people will do when they get hyperthyroidism, they don't have a big success rate in the medicine, neomercazole. They kill the thyroid tissue. They radiation, they remove the thyroid gland or they will kill the thyroid gland. Then hyper is converted into hypo. For hypothyroidism, they have got a good drug called eltroxin. So lifelong they will give eltroxin. So that is thyroid failure. Secondary hypothyroidism is pituitary TSH deficit. If hypopituitarism is due to pituitary adenoma or apoplexy or infiltrative disease like sarcoidosis, the pituitary TSH is not properly giving signal to the thyroid secretion. Then also secondary hypothyroidism develops. Tertiary hypothyroidism is hypothalamic deficiency of thyroid releasing hormone, a rare condition from hypothalamus of the brain. Another concept is peripheral resistance to the action of thyroid hormone. So this is called Margavarana-janya hypothyroidism. Peripheral resistance is Margavarana-janya hypothyroidism, where kapha, meda, ama, mamsa, meda, kleda, all these doshas will cause peripheral resistance, and then also hypothyroidism manifests, and it is called peripheral resistance induced hypothyroidism. It is similar to insulin resistance. There is one Padartha Vijnana's Vyapti, yatra yatra insulin resistance, tatra tatra peripheral resistance to the action of thyroid hormone. So you should give insulin resistance treatment, then hypothyroidism can be treated. That's why some of the drug like Amalaki Swarasam, Amalaki Rasayanam, or Abhayamalaki Rasayanam, Gomutra Haritaki Kalpam, and Nishamalaki Prayogam, Haridra Prayogam, Haridra Sattva Prayogam, they are going to decrease the peripheral resistance to the action of the thyroid hormone. Thyroid hormone is secreted, but due to the peripheral resistance, due to the Margavarana in the peripheral tissues, Shaka Raktadestokcha Bahiroga Enamitat. In Bahiroga, there is a peripheral resistance, and hence there is no activity of thyroid hormone, T3, T4. So these primary etiological understanding is required for Roganidana experts. I dream in future a case of Kaya Chikitsa should be referred to the Nidana department to diagnose primary cause, secondary cause, tertiary cause, or peripheral resistance cause, or Raktavasroto Mula Vikaras causing resistance, Rakta Dushti causing Shonitaja Vikara, Shonitaja Meha, Shonitaja Kleda, or Kleda Vahana is damaged, Medo Avarana is damaging, then that Roganidana diagnosis is made and sent back to the clinical department. This sort of interdepartmental integration is my dream. Hypothyroidism is classified into primary hypothyroidism, subclinical hypothyroidism, secondary or central hypothyroidism, transient or temporary hypothyroidism, or consumptive hypothyroidism. These are all the recent trends. 90% of the hypothyroidism is primary hypothyroidism. It is characterized by high serum thyrotrophin, TSH is increased, and low serum free T4. T4 is low, FT4 is low, TSH is raised is primary hypothyroidism. Subclinical hypothyroidism is defined biochemically as normal FT4 concentration in the presence of an elevated TSH concentration. Other terms for this condition are called mild hypothyroidism, early thyroid failure, preclinical hypothyroidism, and decreased thyroid reserve. This subclinical hypothyroidism is 100% reversible by Ayurvedic Chikitsa of Vamana, Nasya, and Rasayana Prayogas. Kanchanara Kashaya Nasapanam, Kanchanara Twak Tailam Nasyam, all these are effective. Gandhira Tailam, Nasyam are very definitely going to reverse this subclinical hypothyroidism. So Upashaya, Anupashaya, Bhyam Pariksheti is Roganidana concept. Subclinical hypothyroidism can be tested by Kanchanara, and Kanchanara is bidirectional. It is effective in hyperthyroidism as well as hypothyroidism. Shunti Haritaki is also effective in this subclinical hypothyroidism. By Upashaya Anupashaya Abhyam, we can check this. Gomutra Haritaki is also one of the rasayana for tested in Upashaya Anupashaya for subclinical hypothyroidism. The central hypothyroidism is characterized by low T4 concentration and serum TSH concentration. T4 is also low, TSH is also low. This is a secondary hypothyroidism. Transient or temporary hypothyroidism can be observed as a phase of subacute thyroiditis. Thyroiditis is pitta samsrishta hypothyroidism. Due to the inflammation, vata kapha or vata pitta, there is inflammation of the thyroid gland, then there is thyroid swelling. If you check by the trans thyroid ultrasound scanning will tell you thyroiditis. There are different thyroiditis. Hashimoto's thyroiditis is an autoimmune thyroidism. So autoimmune thyroiditis is Nija Vyadhi. It is going to cause some of the problems related to transient hypothyroidism. Thyroiditis is reversible. Aragyavardhini, Mahamanjishtadi Kashaya, Aragvadadi Kashaya. I remember Professor Dr. M. Ishwar Reddy sir, late Dr. M. Ishwar Reddy sir was using Aragvadadi Kashayam for this transient hypothyroidism. We have seen many of the transient hypothyroidism cases will be reversed. Consumptive hypothyroidism, identified in an increasing number of clinical settings, is the result of accelerated inactivation of thyroid hormone by type 3 iodothyronine deiodinase. This D3 is going to cause consumptive hypothyroidism, where there are nowadays this reactive hypothyroidism is increasing in the market. So functional types and autoimmune types can be classified in thyroid hormone diseases. This euthyroid 6 syndrome is functional hypothyroidism. Hashimoto's or Graves' thyroidism is autoimmune thyroidism. In the functional hypothyroidism, thyroid is normal, but the thyroid is not making enough hormone. Our body is not using thyroid hormone properly. See, this is the Dhatvagni Vyapara. Even though available hormone is there, its function is not proper. This is Prathama Dosha Dushtim. It is due to Amavastha in hypothyroidism. Autoimmune thyroidism is thyroid is being damaged by other part of the body, may be experiencing damage. So there is no treatment required for functional hypothyroidism. And for autoimmune hypothyroidism, radioactive destruction of thyroid gland is practiced by modern medicine. For functional type of hypothyroidism, I prescribe Amapachana, Langana, Doshavasechana, Chikitsa for functional hypothyroidism. Allopathic people say there is no requirement of treatment. Autoimmune thyroidism, they will treat radioactive destruction, but I call Samshodhanam, Lekhanam, Ullekhanam, Vamanam, Urdhvada Shodhanam is Upashaya for autoimmune disease, autoimmune hypothyroidism type. There are some important things Roganidana student must understand is hypothyroidism is due to central factor, that is from the hypothalamo-pituitary thyroid axis disorder. Second is goitrogens. This is from the external type. It is acquired type of agantuja, acquired ahara viharajanna hypothyroidism. Goitrogens are group of food and drug which will cause the goiter development or thyromegaly development and hypothyroidism. Like antithyroid drugs in modern medicine, most of the modern cough medicines, they are goitrogens. So you can understand this is Vaidyakrita Aparadajanya goitrogen leading to hypothyroidism. You make a clinical understanding. Anybody comes with preclinical hypothyroidism or hypothyroidism, ask the history of cough medications. How many cough medicines they take in 1 year? Sulfonamides commonly used in endocrine practice. One of the important practice I have seen in psychiatry is lithium carbonate. When lithium carbonate is excessively used for a longer time for mood disorders or bipolar disorders, lithium-induced hypothyroidism starts. So whenever you are giving lithium drugs in psychiatry, if you ask in history in Roganidana, if patient is taking lithium carbonate medicine, then definitely check thyroid hormone and it will be hypothyroidism. Phenylbutazone, oral hypoglycemic agents. See, all Indians, like 70% of Indians are having hypoglycemic agent market. And all anti-diabetics who are taking modern medicine, they will definitely get a goitrogenic effect of modern drug-induced hypothyroidism. So, hypothyroidism causes type 2 diabetes mellitus. Type 2 diabetes mellitus medicines will cause hypothyroidism. See, this is a vicious cycle. That's why Acharya Charaka says in Chikitsasthana 15th chapter, Santatya Bhojyadatu Nam Parivrittistu Chakravarti. There is a parivritti of Chakravarti. Diabetes is due to insulin resistance. Insulin resistance will cause thyroid resistance, and thyroid resistance will cause hypothyroidism. Hypothyroidism will cause diabetes. Anti-diabetics will cause hypothyroidism. So patient will become a double patient. And a diabetologist will refer to endocrinologist will refer to diabetologist. But both can be well treated by a diagnosis of Ayurvedic Roga Nidana Siddhantas. I'll give examples of soya beans in the market, millets in the market, cabbage in the market. Cabbage is definitely a food goitrogen. Eating of cabbage can cause hypothyroidism. See the millets and soya beans. Nowadays, there is a lot of marketing and advertisement of advertisements for millets. Kindly mute. Okay. So millets are kudanyas according to Ayurveda. A Roganidana expert must give attention, please. Kodrava and all these millets are kudanyas. Why our Nigantukaras have talked it as kudanya? Kudanya means if you take excessively for a longer time, these dhanyas are ku. They will cause some of the dosha dushti. That's why excessive consumption of millets is not good, because millets are nitrogens. Weekly once or twice occasionally using of millets is good for Kledahara, Medahara, Kapahara, Shotahara and Madhumeha. But excessive consumption of soybean products and millets may be goitrogens according to modern research. So Kodrava is not to be taken for much time, longer duration in high dose. Overt hypothyroidism. Who is at risk? Patients at routine examination who are taking lithium carbonate therapy, they will get autoimmune thyroiditis. Psychiatric patients, elderly patients, Alzheimer's disease patients, patients with hypercholesterolemia. See, Abadha Medas will cause Prameha and Madhumeha. And Abadha Medas will also cause autoimmune disease, Graves' encephalopathy. Postpartum women will get this problem. Strong family history of thyroid disease with genetically predisposing will get autoimmune thyroiditis, thyrotoxicosis, or even some of the patients who are taking amiodarone therapy. Amiodarone is one of the cardiac drugs. If you go back to the modern pharmacology, amiodarone is anti-arrhythmia drug. A long-term usage of amiodarone will cause overt hypothyroidism. Amiodarone is prescribed by cardiologist. A Ayurvedic Roganidana expert must give attention to these modern drug-induced overt hypothyroidism. Congenital hypothyroidism is Kulaja hypothyroidism, Kulaja pravritti. Less than 10% are diagnosed based on clinical features like prolonged jaundice. I have seen 1.6 bilirubin for longer time. Feeding problems in the neonates, hypotonia of the muscle, enlarged tongue, delayed bone maturation, and umbilical hernia. In these cases, one of the suspicion is hypothyroidism. A permanent neurological damage results due to this. Typical features of adult hypothyroidism may also be present. Other congenital malformation, especially cardiac malformation, should be understood with congenital hypothyroidism. Fallot's tetralogy, whenever you are seeing, check about hypothyroidism. See, this is congenital hypothyroidism pictures. Their face is round, puffy, Gandakshikuta Shotam, eyes are small, gynecomastia, and these cases are suspected congenital hypothyroidism. Here you see the shaka are very thin and abdomen is enlarged, nose is enlarged, and orbital faces are orbits are enlarged. This is cretinism. There is a mental retardation, growth deficit, paraplegia, lower limb is having karmahani, rigidity, snayu sankocham stambam, deaf and mutism, indriya pradoshaja vikaras, facial expression disturbances, So by these neural and musculoskeletal defects arising from the deficiency of the thyroid hormone is cretinism. Autoimmune hypothyroidism is disease Ama Vishajanya hypothyroidism. Hashimoto's thyroiditis or goitrous thyroiditis, large stages of this disease, minimal residual thyroid tissue. Atropic thyroiditis is also seen in this case. The autoimmune process gradually reduces the thyroid function. There is a phase of compensation when normal thyroid hormone levels are maintained by a rise of TSH. Though some patients may have minor symptoms, this state is called subclinical hypothyroidism. This is hypothyroidism Purva Rupa or early Rupa or Prathama Rupa. Unbound T4 levels fall and TSH level rise further, and symptoms become more readily apparent at this stage. TSH is more than 10, which is referred to as clinical hypothyroidism or overt hypothyroidism. So above TSH level, the patients must be seriously treated because it is an autoimmune hypothyroidism. In Hashimoto's thyroiditis, there is a marked lymphocytic infiltration of the thyroid with germinal center formation, atrophy of the thyroid follicles. See, this is thyroid dhatukshayam, accompanied by oxyphil metaplasia, absence of colloid, and mild to moderate fibrosis. Fibrosis is one of the dhatukshaya lakshana. Here, Yashtimadu Kshirapaka is going to be effective. For Upashaya, you can check this. Yashtimadu Kshirapaka, Madhu Yashtyadi Taila Navananasyam, Pratimarshanasyam, Yashtimadu Rasayanam, Shirena Yashtimadu Kasyacha. Hashimoto's thyroiditis we come across in primary infertility in male, where sperm count is less and erection is less. We diagnose Hashimoto's thyroiditis. In atropic thyroiditis, the fibrosis is much more extensive, lymphocyte infiltration is less pronounced, thyroid follicles are almost completely absent. Atrophic thyroiditis likely represents the end stage of Hashimoto's thyroiditis rather than the distinct disorder. This is very tough to treat, where after Vamana Virechana, Shiro Basti Nasya, followed by Rasayana Chikitsa is required. Indrokta Rasayanam, Abhayamalaki Rasayanam, and in Rasayana chapter there is Dhatri Grutam. These drugs, Nasayanam, Mahachaitasagruta Nasyam, will also be effective in this atropic thyroiditis, a tough condition. Genetic association. Hypothyroidism is a Bija Pradoshaja Bhaga, Vikara. Bija Janaka Bija Bhagavaya Dushti in the Matarahar Vihara Prakriti or Kalagarbhashaya Prakriti in the antenatal period. The HLA-DR 345, CTLA4, cytotoxic T lymphocyte associated antigen 4. This polymorphism causes genetic hypothyroidism. If you are unable to detect any goitrogens or HETU, then genetic test may be done for HLA-DR. Modifying environmental factor or chronic exposure to high iodine diet. Who are in the seashore, they will have more iodine in their diet, and they will be having this disease. There is no role of infection except congenital rubella syndrome. We come across secondary infertility or Kaka Vandya, where recurrent abortion is due to the rubella infection. The kids born to that rubella positive female will have hypothyroidism due to the infection. Agantuja crimigenia hypothyroidism. When to test hypothyroidism, I'll give a list of clinical symptoms as well. Whenever there is a fatigue, daurbalyam, cold intolerance, shita dvesham, vibandham, the smriti vibramam, and chitta vibramam, vishadam, there is nerve entrapment syndrome like carpal tunnel syndrome. Whenever you get a vata vyadhi, check hypothyroidism. Ataxia, gati vikaras, muscle weakness, mamsabalakshan, muscle cramps, khalli, infertility, vandya in male and female, bradycardia, whenever there is heart rate decreased, diastolic hypertension, hypothyroidism must be checked. Hoarseness of the voice, swarabedam, goiter, galagandam, periorbital edema, there is gandakshi kuta shotam, a panduroga lakshanam, weight gain, staulya lakshanam, and galactoria. It is a common in female infertility, where from the stana there is a whitish secretion comes. It is due to hyperprolactinemia, and it is also having a chance of hypothyroidism. Hypercholesterolemia patient must be checked with TSH levels. Hyponatremia, hypoprolactinemia, hyperhomocystinemia. In my clinical practice, I am seeing more number of hyperhomocystinemia due to the nutritional deficiencies, CPK elevation, creatinine phosphokinase we evaluate in muscle-based disorders, and especially in case of Duchenne's muscular dystrophy, there should be checking of hypothyroidism. In Roganidana aspect, this slide is very important. We must give a lot of attention toward this. Pericardial and pleural effusions. Whenever there is urasthoium, pituitary gland enlargement, then also hypothyroidism must be checked. Risk factors for hypothyroidism are diffuse goiter, Graves' disease, family history of autoimmune thyroid disease, Down syndrome, family pulmonary hypertension. Whenever there is primary pulmonary hypertension, multiple sclerosis in Vata Vyadhi, previous thyroid operations, radioactive iodine therapies, postpartum hemorrhage and postpartum status, drugs which are having a drug history of the patient, lithium carbonate, amiodarone, interferon alpha, thalidomide, Vitoxin, hypothalamic disorders, pituitary disorders, in all of them, thyroid must be checked. So in common to remember, the causes of hypothyroidism are Hashimoto's thyroiditis, iodine deficiency, treatment for hyperthyroidism, medications, lithium, etc. See, these are all diseases related to understand thyroid disease. Hashimoto's thyroiditis will have TSH rise, TPO antibodies rise. There is a slowly progressive disease. When thyroidectomy is done, TSH is high, history of surgery is there, and surgical scar is seen in the neck. Radioiodine therapy, TSH is raised, history of 131 iodine treatment is there, history of thyrotoxicosis. So drug induced, like whenever drugs like amiodarone, lithium, interferon, iodine, thionomides, when their medication history is there, TSH is raised. So these cases must be checked very well. Whenever a patient says he is unable to wear his jeans pant, he is unable to zip the pant, then there is a chance of hypothyroidism. The interpretation of thyroid function test is like this. When TSH is raised, T4 is raised, there is pituitary hyperthyroidism, thyroid hormone resistance. When TSH is high, normal T4 is there, subclinical hypothyroidism is there. When TSH is raised, low T4 is there, it is primary hypothyroidism. When TSH is normal, T4 is raised, sampling within 6 hours of the thyroxine dose is to be suspected. When TSH is normal, T4 is normal, thyroid is normal. When TSH is normal, T4 is decreased, pituitary hypothyroidism, severe non-thyroidal illness. When TSH is decreased, T4 is raised, it is hyperthyroidism. It is opposite to hypothyroidism. When low TSH is there, normal T4 is there, it is subclinical hyperthyroidism, subtle thyroxine over replacement, or autonomous functioning thyroid nodule or non-thyroidal illness. When low TSH is there, low T4 is there, it is pituitary or hypothalamic hypothyroidism, severe non-thyroidal illness. Major causes of hypothyroidism are primary hypothyroidism, central hypothyroidism, general hypothyroidism. In primary hypothyroidism, autoimmune thyroiditis, thyroidectomy, iodine deficiency, drugs like lithium and amiodarone, infiltrative diseases, and transient hypothyroidism due to subacute lymphocytic thyroiditis. So these are all other causes of hypothyroidism, like iatrogenic hypothyroidism. It is very common cause of hypothyroidism. It is in first 3 to 4 months after radioiodine treatment. Transient hypothyroidism may occur due to the reversible radiation damage. Here, Amalaki Rasayanam is effective. TSH levels are suppressed by the hyperthyroidism. Unbound T4 levels are better measure of thyroid function than TSH in the months of following radioiodine thyroid treatment. After radioiodine treatment, TSH, T3, T4 must be checked. Hashimoto's thyroiditis is chronic lymphocytic thyroiditis. The white blood cells enter into the thyroid follicles and it will cause inflammation. It is a Pitta Pradhana hypothyroidism. Probably the most common cause of hypothyroidism. Younger patients are more. Goiter is present in the older patients. Higher titer of autoantibodies to thyroidal, anti-TPO antibodies, antimicrosomal antibodies. CAMA test. Antimicrosomal antibody is AMA. In Ayurvedic perspective, AMA. In modern perspective, antimicrosomal antibodies, they are definitely circulating antibodies of thyroid gland due to the Hashimoto's thyroiditis. These circulating antibodies, Kupitanam doshanam sharire paridavatam mitra sangaha khavagunyat vadis tatropajayate, is manifested. That's why Hashimoto's thyroiditis must be very carefully experimented in the patient. This hypothyroidism pathogenesis is like this. Characteristic finding is accumulation of glycosaminoglycans, mostly hyaluronic acid, in interstitial tissues. When you do biopsy of thyroid gland, glycosaminoglycans are accumulated in the hyaluronic acid is accumulated in the interstitial tissue of the thyroid gland. So what is this? This is a protein going to be sitting in the thyroid gland. This is once again amadosha, amasanga in thyroid gland. So this is udana sthane kafasangaha, udana sthane kafadushti, or kafasthane kafadushti, because gala is one of the kafasthana also. In gala kafasthane kafadushti, kafasthane amadushti, udana vayusthane amadushti. Like this can be Ayurvedic interpretation can be thought of. The accumulation is due to the excessive synthesis but decreased destruction of glycosaminoglycans. So this is dhatu visha, ama visha, which is present in the thyroid gland, pratama dosha dushtim, and this is ama visha developing, and if it is not thrown out, then it causes the hypothyroidism. So what is Ayurvedic concept is Rutu Samshodhana and Rutu Rasayana. According to the Rutu, Samshodhana should be done. According to the Rutu, the Rasayana should be done. My proposal to the government is that Rutu Samshodhana and Rutu Rasayana should be made as national health programs. Then only we can prevent these glycosaminoglycans deposition and destruction in the human thyroid tissues. Clinical manifestation of hypothyroidism. You should see this hypothyroidism clinical manifestations. I always talk about this. If you see Vatavruddhi Lakshanas, we can understand hypothyroidism. See, Karsha is hyperthyroidism, Karshna is hypothyroidism, Ushna Kamitva is hypothyroidism, Kampa is hypothyroidism, and as well as hyperthyroidism. Kampa is more seen in hyperthyroidism, less seen in hypothyroidism. Karsha, Kashoshna, Kampa. Anaha is hypothyroidism. Anaha of Vatavruddhi Lakshana is hypothyroidism. Shakrut Grahan. So Vibandha Shakrut Graha is a chronic problem in some of the patients where Anuloma drugs are not effective, Virechana is not effective, Matrabasti is not effective. Then check thyroid gland functioning. Bala Nidrindriya Bhramsha. The Bala Bhramsha, Nidra Bhramsha, Indriya Bhramsha of Vatavruddhi Lakshanas. All these are definitely hypothyroidism Lakshanas. I was telling in the previous slides, it will also come in the future slides. See, Bala Bhramsha, Nidra Bhramsha, Indriya Bhramsha. Anidra is also due to hyperthyroidism. Atinidra is due to hypothyroidism. Karsha, Karshna, Ushna Kamitva, Kampana, Shakritgraham, Bala Nidrendriya Bhramsha, Pralapa is hyperthyroidism. Brahma is hyperthyroidism. Dainyatvam is hypothyroidism. By seeing Vatavruddhi Lakshanas, we can understand hypothyroidism. See, one more guna concept of understanding hypothyroidism is Guru Guna Vruddhi, Manda Guna Vruddhi, Snigdha Guna Vruddhi, Tandra Vruddhi, they are all hypothyroidism. Agni Mandya. Agni is Pitta. Pittasya Tikshna Ushna Guna Hani is hypothyroidism. Tikshna Guna Vruddhi is hyperthyroidism. Hypothyroidism is Kafaja Vyadhi, Vata Kafaja Vyadhi. Hyperthyroidism is Vata Pittaja Vyadhi or Pittaja Vyadhi. So with this simple Ayurvedic interpretation, we can start diagnosing hypothyroidism. Another thing I'll tell you is Shofa, Shota is hypothyroidism. Staulya, Shleshma Meda Vruddhi is hypothyroidism. Kapha Meda Vruddhi is hypothyroidism. Mamsakshaya, Balakshaya, Shosha, Karshya is hyperthyroidism. Ati Santarpana Janya Vyadhis of Charaka Sutra Sthana is all Santarpanotta Vikaras are hypothyroidism. All Apatarpanotta Vikaras are hypothyroidism. If this basic understanding is seen, even first year BAMS student who knows Santarpana, Apatarpana, Vatapitta Kapha Vruddhikshaya Lakshanas, he can understand. Rasopi Shleshmavad, Rasa Vruddhi Lakshanas, Rasaja Pradoshaja like Ashraddha, Aruchihi, Shasa, they're all Jwara. See, in Jwara is also we can understand hypothyroidism. Manda Jwara, Antarvegi Jwara, Kafaja Jwara are having hypothyroidism Lakshanas. Due to the thyroiditis, there will be Jwara. And antibiotics have no role to play in this. Our autoimmune disease management by Rasayana Chikitsa is effective here. And Ati Pralapa, Ati Santapajanya Jwara is having hyperthyroidism. Pyrexia of unknown origin with hyperthyroxia, hyperpyrexia is hyperthyroidism. Hypopyrexia, very manda jwara will be there, that is hypothyroidism. So you can understand the mechanism of hypothyroidism lakshanas. Symptom is fatigue and weakness, daurbalyam, bala nidrendriya bhramsham. It is a slow movement and slow speech. See, if a person talks like, hello, good morning, very slow lakshana, according to L. Mahadevan, he says this is kapha prakriti lakshana. According to me, it may be kapha prakriti lakshana, sometimes it is kaphaja vikara like hypothyroidism lakshana. If some of the patients are asked to walk, they will walk very slowly. It may be due to vataja gatikshayam hypothyroidism or kaphaja guru guna vruddhim hypothyroidism. The cold intolerance, very simple. Some of the patients cannot tolerate cold. You ask Shita Ushna Gunam, two gunas should be explored in hypothyroidism. If patient says Shita Guna Dvesham, cold intolerance, this is the Pradvesho Vruddhi Hetushu. This is Sanchaya Prakopa Avastha, you should understand. Pradvesho Vruddhi Hetushu. When patient is unable to tolerate Shita, it is hypothyroidism. When patient is unable to tolerate Ushna, it is hyperthyroidism. These two features can be understood. Slowing of metabolic process is the common mechanism. So what is Chikitsa is increase the metabolic process, increase the Dhatogni Vyapara, increase the Jataragni Vyapara. Dyspnea and exertion. Arohana Ayasam may be Pandu Rakshana, Arohana Ayasam may be a renal failure Lakshana, Arohana Ayasa may be congestive cardiac failure or left ventricular hypertrophy Lakshana. Maybe these are cardiac things, by the bradycardia may be the sign. This is metabolic process is decreased. This is Kaphaja Lakshana. Weight gain is a Lakshana of hypothyroidism. So there is Santarpana Janyavyadi. Even patient takes small amount of food, he is increasing in his weight. Some of my patients come to clinic says, sir, I'm doing diet by my weight is increasing. I'm taking less food and my weight is increasing. This is due to hypothyroidism. Because hypothyroidism, there will be fat cell is are not increased. Fat cell is enlarged. It is Vyasa, one of the Vata Prakopa Lakshana. Mental retardation in the infant, when school going children are not coping with the class, then the teacher complained that go to Ayurvedic doctor and take some Swarna Prashanam. Then check the kids' thyroid levels. Constipation, anybody, child, middle age or old age, a frequent constipation should be checked for hypothyroidism. It is because of its metabolic rate is decreased. Then Agnitundivati like Kuchala is one of the better drug to treat hypothyroidism as well as Dhatwagni Mandya. Growth failure, if the kids are not having proper growth, it is due to the hypothyroidism. Accumulation of matrix substances, it will cause dry skin, harshness of voice, edema. Padashotam, Sarvangashotam, Mukashotam, and Twagruksham. Twagruksham is a Tvachagata Vata Lakshana. Twagruksham may be Myxedema Lakshana, hypothyroidism complication Lakshana. So coarse skin, puffy faces, or periorbital edema, enlargement of the tongue. These are all Pandu Lakshanas, Shota Lakshanas. Shota is one of the different Ayurvedic diagnoses, but one common diagnosis may be hypothyroidism in Shota, hypothyroidism in Pandu. Decreased hearing. See, Shravana Karma Hani, Shravanendriya Karma Hani is due to hypothyroidism. And myalgia and paresthesia. Myalgia is Angamarda. Angamarda is one of the hypothyroidism Lakshana. And the Karapada Daham is one of the Prameha Pururupa, Prameha Upadrava, Prameha Lakshana is hypothyroidism feature. Depression is a hypothyroidism feature. Menorrhagia. Atirakta Srava, Atyartava is Pittaja Artava Dusti. Or it can also be hypothyroidism. Due to hypothyroidism, there is menorrhagia. Arthralgia, joint pain may be hypothyroidism. Pubertal delay, delayed puberty is also hypothyroidism. Mixed edema, Padashota Lakshana is hypothyroidism. Hashimoto's encephalopathy, it is a steroid response. Due to the anti-TPO antibodies, increased myoclonus, increased slow wave activity on the EEG. In the electroencephalogram, the wave pattern is very slow, is Kapha Lakshana. And this Kapha Lakshana is Hashimoto's encephalopathy. Clinical manifestations of skin and hypothyroidism. If the Shita Sparsha is there and Pandu Lakshana and the Tvacha is there, blood flow is decreased, Pitta Kshayam Kapha Vruddhihi hypothyroidism. Dry roughness skin, Vata Vruddhihi Kapha Kshayam hypothyroidism. Epidermis has got atrophied cellular layer. Hyperkeratosis is one of the Vata Kushta Lakshana, and it is hypothyroidism. Decreased sweating. Somebody says even in Ballari people are not sweating. This is hypothyroidism. Generalized non-pitting edema, mixed edema is a severe hypothyroidism. Mixed edema is going to cause coma. So mixed edema is upadrama of hypothyroidism. Hypothyroidism in the eyes is periorbital edema or Graves' ophthalmopathy. And in hypothyroidism, cardiovascular lakshanas like bradycardia, vatasya gati kshayam, an impaired muscular contraction, it is mamsa kshayam, reduced cardiac output. When ejection fraction is low, check hypothyroidism. ECG, low voltage QRS complex, P wave and T waves, then it is hypothyroidism. In chest X-ray, cardiomegaly is hypothyroidism. Pericardial effusion is hypothyroidism. Left ventricular dilatation may be due to hypothyroidism. In case of cardiovascular cases, hypertension due to the peripheral vascular resistance. See, due to the atherosclerosis, Dhamani Pratichaya, Dhamani Upalepa, Kapha Vruddhi, Meda Vruddhi, Ama Vruddhi, and Kapha Meda Savrata Vata, they are all going to give cardiovascular presentations of hypertension and hypothyroidism. So in case of respiratory system, hypoventilation, shallow and slow respiration. It is due to the respiratory muscle weakness, reduced pulmonary response to hypoxia and hyperapnea. This is obstructive sleep apnea. You can see patient in the midnight gets suddenly choked up and gets up and drinks water and he is having breathlessness. This may be one of the condition of hypothyroidism. In gastrointestinal tract, I was telling about constipation, gut motility is decreased, taste sensation. The rasa swada is decreased, gastric atrophy is there, weight gain is there due to decreased metabolic rate. These are all hypothyroidism. In case of nephrology, GFR rate is decreased. Glomerular filtration rate less than 106 is hypothyroidism. Impaired ability to excrete water load. See, Jalamahabhuta is not taking proper excretion. Apana is responsible for excretion of Mutra, Mala, Shukra, Garbha and Artava. If Jala in the form of any Dushyas or Malas, if Jaladhatu is not properly excreted, Apana Dushti and hyperthyroidism. The drug clearance, anti-epileptic drugs, anticoagulants are not properly excreted due to the hypothyroidism manifestation. Panduroga, impaired hemoglobin synthesis in reticuloendothelial system, liver, spleen, and bone marrow. When these Majja Agni, Rakta Dhatu Agni Dushti is there, and Rasa Ranjana Karma of Ranjaka Pitta is in trouble, it is due to hypothyroidism also. Folate deficiency, iron deficiency, vitamin B12 deficiency in pernicious anemia. See, Roga Nidana's perspective of Pandu, Rudroga, Shwasa, Grahani Dosha, Shukra Dushti, infertility, hair loss, obesity management, anything you take, hypothyroidism is one of the Roga Nidana diagnoses we should make. In case of reproductive abnormality like hyperprolactinemia, decreased fertility rate, menorrhagia, hypermenorrhea, epimenorrhea, even see the beauty of Arthava Dushti, oligomenorrhea, amenorrhea, hypermenorrhea, menorrhagia, all may be due to hypothyroidism. And I was always surprised in my 22 years of experience, some of the product explaining people come to my clinic and tell, one tonic is there, it is effective in amenorrhea, dysmenorrhea, menorrhagia, menometrorrhagia, dysfunctional uterine bleeding. All gynecological problems, one Ayurvedic tonic is effective. I am not understanding till today because their Lodra Ashokadic Kashayam or Lodra Ashoka containing drugs not necessarily having anti-hypothyroidism actions. So that's why the current trend in diagnosing menorrhagia, amenorrhea, hypermenorrhea, epimenorrhea, oligomenorrhea is hypothyroidism. So there is no question of gynecological intervention of modern medicine. Ayurvedic endocrinological intervention is required. It is due to the Rakta Skandana Guna dosha. Please check prothrombin time and APTT time, INR values, and treat that, and not the Rakta Stambhana, Artava Stambhana Gana is not effective. Ashoka Ghrutam is not effective. You should try to give Kasi Sabasmam along with Kanchanara Guggulu and Arogyavardhini. Then this hypothyroidism leading to oligo, amino, hyper or menorrhagia will be checked out. Decreased fertility. Stree Vandyatva and Purusha Vandyatva will be having hypothyroidism. Sex hormone binding globulin concentration may be low in hypothyroidism. So when you check SHBG, if you write testosterone evaluation, there will be SHBG is decreased. When oligospermia, sperm count is less, SHBG will be decreased. Then it is hypothyroidism. In neurological things, inability to concentrate, sleeplessness, anidra, bala nidrendriya bhramsha, I was telling, nidra bhramsha is vatavruddhi lakshana, nidra bhramsha is vatavruddhi, kafakshaya, pittakshaya and hypothyroidism lakshana. And next is sluggish thought process. Some of the school going children will have this agitated psychosis, myxedema, madness is unmada lakshana. Neuromuscular abnormalities like carpal tunnel syndrome, deep tendon reflexes are delayed. Then it is in Pakshagata, when you get deep tendon reflexes are delayed, it is Vatasya Gatik Shayam, it is Vatakshayam Kapavruddhi hypothyroidism. Paresthesia, Padatala Daha or Kara Daha is one of the Puru Rupa and Rupa of Madhumeha. It may be also due to neuromuscular abnormality of hypothyroidism. The muscle cramps and muscle weakness is due to the hypothyroidism. Whenever patient comes with Indrabasti Marma getting pain, Indrabasti Nishpedanam is Puru Rupa of Jwara. It is one of the Lakshana of hypothyroidism. See, the scope of hypothyroidism from Jwara to Arthavadushti or Jwara to Jara. Jwara to Jara, hypothyroidism can be diagnosed in every patient. After hearing to this lecture, you can see that every patient looks like hypothyroidism. You see any patient from hair to toe, Kesha Palitya and Kesha Patanam or periorbital edema, tastelessness or swelling of the face, swelling of the neck, sluggishness of the movements. You take anything, Agnimandyam, Anarthavam, Vibandam, Shukra Vikaram, all body diseases are having hypothyroidism as one of their features. So I want my students and delegates to understand this feature, and in your general practice and clinical practice and research activities, whatever research you are doing in Ashtanga Ayurveda, one protocol must be there for hypothyroidism evaluation in the current scenario. Because of goitrogens, because of the environmental influences, because of the viral infections, because of the bad lifestyle and bad westernization of our thinking and our food style, every case, Jwara to Jara, you must have one question of hypothyroidism in your mind. Like in metabolic diseases like hyponatremia, low density lipoprotein cholesterols, homocysteine level increasing, they are all hypothyroidism. So you can see hypothyroidism and depression. Psychosomatic aspect of hypothyroidism, Sharira and Manasa Bhavas like depression and hypothyroidism. Sleep decrease, suicidal tendency, weight change, delusions, bradycardia, cardiac and lipid abnormalities, cold intolerance, goiter, hair and skin problems. They are all having combination of common thing is depression and hypothyroidism are common with constipation, decreased concentration, decreased libido. See, the Clibia, Dwajabanga is also having hypothyroidism, depressed mood, diminished interest, fatigue, and weight increase. Some of the patient will tell, sir, every day I'm feeling weakness, tiredness, lack of interest. I'm having a lot of body pains. I don't want to work. I don't want to go to school. I don't want to drive. Then check out on hypothyroidism in your practice. Drug clearance like anti-epileptic drugs, anticoagulants, hyponatric acid, opioid drugs, modern opioid drugs will decrease the clearance of kidney. In the laboratory, you should test total T4, total T3, FT3, FT4, TSH, T3 uptake, FT4 index, FT3 index, antithyroid antibodies, antimicrosomal antibodies, nuclear scintigraphy in case of thyroid cancer, FNAC of nodule. Whenever you palpate a thyroid nodule, immediately go for FNAC as a basic test. Thyroid antibodies are many antibodies are there in the blood. Antimicrosomal antibodies, antithyroglobulin antibodies, antithyroid peroxidase, anti-TPO antibodies, antithyroxine antibodies, thyroid stimulating antibodies. High titers of TPO antibodies is Hashimoto's and Riddle's thyroiditis. Antithyroxine antibodies in peripheral resistant to thyroxine. Anti-TSA antibodies are raised in Graves' disease and hyperthyroidism. In Graves' disease, I have seen sperm count is decreased, puffiness of the face, and Clibia. So common signs and symptoms, weakness, skin changes, lethargy, low speech, eyelid edema, cold sensation, decreased sweating, cold skin, thick tongue, facial edema, coarse hair, skin pallor, forgetfulness, constipation. One of the easy way to understand the hyper and hypothyroidism is Vatavriddhi Lakshana. Karsha Karshoshna Kamatva, Kampana, Shakritgrahan, Bala Nidriyendriya Brahmcha, Pralapa Brahmadimata. Even Vata Prakopa Lakshanas like Samsa Vyasa Vedaswapa, Sada Ruktoda Vedanam, Sanganga Banga Sankocha, Varta Harshana Tarshanam, Kampa Parusha Saushirya, Shosha Spandana Veshtanam. These are all hypothyroidism features in Ayurveda. And there are thyroid progression indexes. Euthyroid will become mild thyroid failure or subclinical thyroid. And once overt hypothyroidism, TSH is increased or in normal range, T4, T3 comes down. This will be a progression. Associated conditions of hypothyroidism is type 1 diabetes, Addison's disease, pernicious anemia, Shvitra Roga. See, whenever anybody researching on vitiligo, don't forget to work on hypothyroidism. Alopecia areata. Indralupta may be a Kshudra Roga, but Indralupta is associated with hypothyroidism. Celiac disease, Grahani Roga, dermatitis hyperpatiformis, chronic active hepatitis. Whenever you are working on Kamala, Kumbha Kamala, rheumatoid arthritis, SLE, Shogun syndrome, thyroid associated ophthalmopathy. In Shalakya Rogas also thyroid is very important. Turner syndrome, Down syndrome, Asadya Rogas, type 1 or type 2 polyglandular autoimmune syndromes. And in these cases, thyroid alone, if hypothyroidism should be tested, TSH with free T4 only if hyperthyroidism is suspected, free T3 and if T3 toxicosis is suspected, don't order for total T4 or total T3. Never order in pregnancy, the radio immunotechnique should not be used. There is a 9 square game. You can interpret the results of thyroid. There are 9 games like this. When free thyroid level FT4 is low and TSH levels are low, then it is basic thyroid evaluation. Thyroid stimulating hormone levels are like this. So it is euthyroid. This is primary hypothyroid, and this is primary hyperthyroid. High levels of T4 and low levels of TSH. And low TSH and low T4 is secondary hypothyroid. And FT4 is high and TSH is high. It is secondary hyperthyroidism. This is subclinical hyperthyroidism, where normal FT4 is there and low TSH is there. Subclinical hypothyroidism, high TSH level and normal FT4 level. And non-thyroid illness, NTI, where normal TSH and FT4 is high. When non-thyroid illnesses on Eltroxin patients, FT4 is raised, TSH is high. So this 9 quadrants you remember as abdomen, 9 quadrants you are examining. Remember, 9 quadrants are having basic thyroid evaluation for Roganidana purpose. You keep these 9 quadrants in mind. Central is euthyroid. From the above, primary hyperthyroidism, non-thyroid illness, secondary hyperthyroidism, subclinical hypothyroidism, secondary hypothyroidism, and primary hypothyroidism. And in the center, non-thyroid illness again. So TSH assays in laboratory diagnosis in Roganidana perspective, primary test to establish diagnosis. When overt hyperthyroidism is there, T3, T4 are down, TSH is raised. In additional cases, estimation of FT3 and T4 is required because thyroid antibodies are there. Then T3, T4 are normal, TSH is raised. This is subclinical hypothyroidism. In this subclinical hypothyroidism, Vamanam, Nasyam, Kanchanara Guggulu are very effective. Aragvadadigana Kashayam is effective and Varanadi Kashayam is effective. Guggulu Tiktaka Kashayam is effective. Amrutadi Kashayam is effective. Even the Tiktakam Kashayam is also effective in subclinical hypothyroidism. High TSH, low T4 is primary hypothyroidism and normal T4 sometimes subclinical hypothyroidism. Elevated TSH, low free T4 is diagnosis of hypothyroidism. Normal TSH until 2002, The range was 0.5 to 5.5. After 2003, there is normal TSH range is 0.3 to 3. In the antenatal period, 2.4 to 2.6 is normal TSH level. Complications of hypothyroidism, increased risk of coronary artery disease. Hypothyroidism is directly proportional to coronary artery disease. Hypothyroidism is directly proportional to diminished cardiac output. See, cardiac output is samana vata karma. It is vyana vata karma. Samana brings rakta to the hridaya, and vyanena rasadatur hi vikshepochita karmanaha yugapat sarva tejasrum dehe vikshipyate sada. This vikshepana karma of vyana vayu is decreased by hypothyroidism. And samana vayu brings back blood to the right atrium. That is inferior vena cava and superior vena cava karma is samana vayu. And from left ventricular ejection is due to the vyana vayu. This karma is decreased by 30 to 50%. It is due to hypothyroidism. Increased peripheral vascular resistance in hypertension and hridroga is due to hypothyroidism. Decreased pulse pressure is due to hypothyroidism. Hypotension under anesthesia is due to the down regulation of beta adrenergic receptor, and it is due to hypothyroidism. Ventilatory dysfunctions are due to hypothyroidism. Iodine deficiency is one of the important things we should understand. Iodine biochemistry and metabolism we should understand. Iodized salt is good. Excessive iodized salt will cause hypothyroidism. Selenium supplementation is very good. Karpara is Ayurvedic drug for selenium, which should be given in antenatal care and all hridroga cases. Avoid cassava and avoid cabbage because they are nitrogens. Avoid formula milks. And fish, meat, milk and eggs are to be avoided. So fish, meat, milk and eggs. White milk is not good for iodine deficiency people. Thyroid diet plans. So you can make this thyroid diet plan. It is for Sastavrta people. In total calorie of 2730, protein must be 60 gram, iron must be 17 milligram, total fat must be 30 milligram, calcium must be 600 milligram, and sodium must be 1200 milligram, and 555 grams of carbohydrate. If you plan your diet like this, it is good for thyroid. To come to some conclusions, thyroid problems need to be treated as soon as possible. Don't make any delay. So firstly, do Pratama dosha dushtim, Ama dosha dushtim. Ama dosha lakshana must be evaluated. Vata vruddhi lakshana, Pitta dushti lakshana, Kapha vruddhi lakshanas must be evaluated. Sama vata, Sama kapha lakshana must be evaluated in hypothyroidism. Guru guna, Manda guna, Sthira guna must be assessed for Kapha. Chala guna must be, Sukshma guna must be, Ruksha guna must be evaluated for Vata dosha. Ruksha guna vruddhi janna Vata vyadhis are there. Ruksha guna vruddhi in charma is due to hypothyroidism. Shita guna is Vata dosha guna. Shita is Vatasya Shitam, Kafasya Shitam. Kapha is also Shita. Kapha is Shita and Dravam, whereas Vata is Ruksha Shita. This Ruksha Shita guna of Vata is responsible for hypothyroidism, and the treatment are long in duration due to the depth of Majja Dhatu. See, why I am telling Majja Dhatu is, Majja is going to give totipotent cells for the development of so many antibodies, so many proteins in the Majja. So when Majja Dhatu is normal, Majja Sara is there, the person thyroid will be good. Majja Dhatugni is directly related to thyroid metabolism. And if Majja Dhatugni is good, the brain functions will be normal, hypothalamus function will be normal, pituitary function will be normal, TSH secretion will be regulated. If Majja Dharakala and Majja Dhatugni Dushti is there, Majja is Vatasthanam, Asti is Vatasthanam, Ashray Ashray Pramanam is there. So never forget to consider Vata, Kapha, Majja, Rakta, Rakta Vasroto Mula, Rasa Vasroto Mula, and all Srotasas, Indriya Vasrotas, Mano Vasrotas, and even Ojo Vasrotas in understanding hypothyroidism. Hypothyroidism must be understood in all angles, and basic angle is Agni, another angle is Dosha, another angle is Dusha and Sroto Mulas, another angle is Sara Pariksha. If you can see Saras, Asara Lakshanas are seen in hypothyroidism. And metabolism is a basic component. The person needs to be treated to cure the problem, not only the symptom. Lakshana should be one of the marker to understand the thyroid, but not that is going to be a cause for treatment. We should treat the problem, that is Agni Vikara, Jataragni, Dhatugni, and Bhutagni Vikaras. Dhatu metabolism needs to be corrected through diet and lifestyle before trying to give herbal treatments or modern treatments or Panchakarma treatments or any Ayush treatments. Whatever may be the treatment, Roganidana is a fundamental platform for our Chikitsa departments. Shalya, Shalakya, Stri Roga, Bala Roga, Jara Tantram, Rasayana Tantram, Vajikarana Tantram, all are depending upon Roganidana department. Roganidana is a basic department of understanding the disease and diagnosing the disease, and also telling the Sadhya Sadhyatvam, and also telling the Niyata Marana Khyapakam Lingam are explained by Roganidana department. So Arishta Lakshanas are to be explained. See, in hypothyroidism, Shota, Shofa, and Chalaguna Rasa, dullness is hypothyroidism Lakshana. Whereas Mixedema, Koma, Madamurcha, Sannyasa is Arishta Lakshanas. Mixedema is Arishta Lakshana of hypothyroidism. So Roganidana expert must also think about these Indriyasthana related activities in their clinical practice. In most cases, diets and lifestyle alone will correct early manifestation of thyroid manifestations. So what I want to tell is correction of the ahara is very important for hypothyroidism. So whenever we ask history in Roganidana, you ask thoroughly the hetus of hypothyroidism, goitrogens, and bad lifestyles, bad eating styles, bad food pattern, bad cooking pattern, and we cannot do anything for pesticide loaded food and very bad usage of wrong antibiotics, multi-drug combinations. Lot of chemical synthetic drugs are doing tried. India is a drug trial dumping ad for Western countries. They are trying lot of toxic drugs on Indian people in cancer or in any immunological diseases. In emergency conditions, they are trying lot of drugs in India. If they are found safe, Western people are using them. So, lot of drug-induced iatrogenic, Vaidyakrita, Aparadajanya, modern pharmacological drug-induced hypothyroidism is common in current scenario. And most of the synthetic drugs and synthetic food supplements, synthetic food processors are responsible for these thyroid choking lakshanas. Why thyroid is choking? One basic thing I want to conclude is the body and mind are very interrelated, and the shock absorber between the body and mind is thyroid hormones. And thyroid hormones maintain the shock absorber activity between body and mind. Stress, anxiety, depression, chitta vidvegam, atatva vinivesham, or gadodvegam, all these things are very common nowadays in the market. If you sit in your clinic, lot of bad questions will be asked by patients because they are seeing all media channels, internets, and they misunderstand so many things. They get afraid. They are thinking very negatively. Due to that, Dhatvagni Vikaras, Amadosha Utpatti, and while eating, they are watching TV or watching mobile and internet. That will cause also Amadosha. And the night shift duties. I have documented many cases in my 90,000 case trial. I can notice that shift duty people will suffer with diabetes and hypothyroidism and depression. So these three are common disease of shift duty people, and who are working in air hostesses and airport aviation employees and truck drivers and KSRTC employees, drivers suffer with lot of Vata Kaphajalya Vikaras. Night drivers will also suffer with this when they get suitable genetic preponderance opens up, they will suffer with this hypothyroidism. In herbal treatment should target the dosha that is controlling either the structure or the function, or in some advanced cases, both should be treated. You try to understand structure as well as functions of doshas and dushas in the body. So Vata and Vata Kapha are hypothyroidism, Pitta and Vata Pitta are hyperthyroidism. Apatarpana Janya Vikaras are common in hyperthyroidism. Santarpana Janya Vikaras, Thaulya, Neshma, Meda, Margavarna, Kafajan, Anatmaja Vikaras, they are all common in hypothyroidism. Though Mandagni is hypothyroidism, Tikshnagni, Atitikshnagni, Bahu Agni, Bahu Tikshnagni are very common in hyperthyroidism. Herbal treatment should target the dosha Ayurvedic treatment should target the dosha that is causing the problem, either in structure or function. With this, I am coming to the conclusion that I am thankful to the organizers, the principal of Ulikal Ayurveda College, organizing committee members, head of the department of Roganidana department, teaching staff of Roganidana department, my friends, delegates, students, practitioners, and all the teaching faculty members. I am very much thankful for you to give me an opportunity to share my experiences and few concepts of hypothyroidism. This is not the end of hypothyroidism. This is one part of hypothyroidism. Thank you for your patience hearing. If I have taken much of your time, sorry. If I have given some of the concepts or some of the thinking, it is from my guru's teaching, and it is all because of my teachers. And my patients have taught me a lot of things. My modern doctors have given me a lot of information. I am thankful to all of them and my parents for all the blessings, and Lord Dhanvantari. Thank you one and all. Namaste.
Hello. Hello. Hello, sir.
Mute them.
Hello.
Okay. Hello. Am I audible?
Hello. Namaste, sir.
No, mute some of the people who are not muted. Okay.
So we have few questions from the participants.
No, so a lot of disturbance is there. Ask them to mute.
Hello, sir.
Okay.
Sir. First question. If a person is suffering from both diabetic mellitus and hypothyroidism, then also the millet is contraindicated?
Yes. See, millets, you study the Nigantus, they are kudanyas. They should be carefully used. Diabetes doesn't require kudanyas. For diabetes mellitus, some of the non-Ayurvedic peoples have promoted kudanyas use as very important for diabetes. Actually, Acharya Charaka says, आप पढ़ेंगे चरक संहिता पढ़ लीजिए. The best stress is given on the yava ahara. The yava should be used for madhumeha and prameha and not the millets. Millets is not Ayurvedic fundamental concepts. Of course, millets are ruksha. Millets are kleda shoshaka. They can be used in mild dose or once in a while. Actually, when diabetes and hypothyroidism are together, best diet is yava. Yava is a good diet supplement. And if you want to use goduma, if it contains gluten, it is not good for diabetes and hypothyroidism. I repeat, wheat is not good because it is having gluten as a protein, which is going to cause problem to diabetics as well as hypothyroidism. Then one of the best technique to come out of this gluten problem in wheat is the Triphala Kwata Bhavana for wheat. Triphala Kwata Bhavana for millets. Then you can use Triphala Kwata Bhavita millets, Triphala Kwata Bhavita wheat, and Yava. And carbohydrates, I was telling in the diet plan, you can reduce 550 grams of the carbohydrates in daily diet. But excessive use of millets is not Ayurvedic concept. A clinical trial can be tried in Roganidana department or even in experimental studies. Excessive consumption of millet is not good neither for diabetics nor for hypothyroidism. Thank you.
So another one question. We have another question. Differential treatment between hypo and hyperthyroidism.
Okay, very good question. Of course, not for the Roganidana perspective. It is Kaya Chikitsa perspective. What is hypothyroidism chikitsa is Vata Kafagnam, Shotaharam, Agni Deepanam, Malaharam, Malapachanam, Rasayanam, Balyam, Tikshnam, Ushnam, and Rasayanam. Whereas for hyperthyroidism, Vata Pitta Prashamanam, Madhura Tikta Kashayam, Brahmanam, Pitta Prashamanam, Tiktam Deepanam, and it should be Santarpanam Brahmanam. Mild Santarpanam Brahmanam should be given for hyperthyroidism. For hyperthyroidism and hypothyroidism, Ayurvedic people were blessed. Kanchanara Twak has been done a clinical trial and experimental studies. Kanchanara Twak is effective in hypothyroidism as well as hyperthyroidism. So I prescribe Kanchanara and Arakvadadi Kashayam or Kanchanara and Varnadi Kashayam for hypothyroidism, Kanchanara and Mahatiktakam Kashayam, Kanchanaram and Tiktakam Gritam, Kanchanaram Chavana Prasham in Vata Pittaja Vikara. That is hyperthyroidism.
So, another question. Whether Medo Dushti is hypothyroidism is due to Baddha Meda or Abadda Meda?
Very good question. We have to assess all Saptadushas, 3 malas in hypothyroidism. Medo Dushti is one of the common presentation of Medo Dhatvatni Mandya in hypothyroidism. Sometimes Meda Savrta Vata is also seen in hypothyroidism. So it is not Baddha Medas and Abadda Medas. Abadda Medas is for Madhumeha and Abadda Medas is also responsible for hypothyroidism. So Abadda Medas, Amam, hypothyroidism, Madhumeham. This is the sequence of Abadda Medas.
So next question. Please mention ophthalmic conditions associated with hypothyroidism.
Repeat.
Ophthalmic conditions associated with.
Yes. I have seen ophthalmopathies in hypothyroidism where Manda Drishti Mandyam, the vision decline is one of the feature of hypothyroidism. The retinal blood flow decreases due to the ophthalmic artery Upalepam, ophthalmic artery Margavaranam, ophthalmic artery Sangam. It is due to hypothyroidism. Due to hypothyroidism, the retinal clarity and even vitreous body and even the optical activity decreases. So there is Kacham, Linganasham can be seen in hypothyroidism. In hyperthyroidism, there will be protruded eyeballs. That is, exophthalmosis takes place in hyperthyroidism. Ophthalmopathy takes place and Drishtimandam, Kacham, Timiram, Linganasham in Netra Vikaras.
Another question. How can we treat a case with hypothyroidism of post-hysterectomy with hypertension disorder?
No problem. See, hysterectomy is done, the female patient. You want to treat hypertension or hyperthyroidism?
Hypothyroidism.
Hypothyroidism.
In post-hysterectomy.
No problem. See, I prevent hysterectomy in hypothyroid cases. I'm sorry to say, hysterectomy doing medical people are only focusing on bleeding for vagina and their pocket. Commercially, they do hysterectomy. Actually, it is not required. If you check thyroid levels 2 or 3 times before hysterectomy, definitely hypothyroidism can be diagnosed. Prothrombin time is raised, APTT is raised, INR value is raised in hypothyroidism, and that's why I was telling hypothyroidism causes menorrhagia, menometrorrhagia, and DUB. Then unnecessarily hysterectomy is done. Okay, leave it. Once hysterectomy is done, hypothyroidism continues. Then you should treat Shonita-ashrita rogas, Shonitaja vikaras, and Shonita Meda kapha rogas. And you should give hepatostimulant, Margavarana hara drugs, Meda Kleda, Meda Savrta Vata hara drugs, Staulyam, Apatarpana Karachikitsam, and Udvartanam, Kafaharam, Vedasaha, Pravilayanam, Sthirikaranam Anganam is the best line of treatment for post-hysterectomy hypothyroidism management. They will develop different cardiac diseases later, different hepatopathies and gastropathies later. Once hysterectomy is done, the hypothyroidism will cause more damage to the Meda and Asti dhatu. So that's why Udvartanam, Kafahara Chikitsa, Vatanulomanam, and Medohara Ganas, like Apatarpana Kashayas, can be given. Aragodadi, Mahamanjistadi, or even Lashuna Barbaradi Kashayam, or even Lashuna Rasayanam, and even Arogyavardhini Kalpam. All these are effective in the post-hysterectomy hypothyroidism. Thank you.
Next question, sir. Hypothyroidism develops after a hysterectomy?
No. Actually, hysterectomy is done without diagnosis of hypothyroidism. Then this question comes. Without thyroid evaluation, hysterectomy is done. Then after some days, we will tell that hysterectomy is done, you have developed hypothyroidism. That's not the case. Hysterectomy is done without diagnosis of hypothyroidism is wrong.
Drug Hamsapadi can be used in hyper or hypothyroidism?
Hamsapadi is better for hyperthyroidism. It is Vatapittagnam, Sheetam, Rasayanam, Medyam, Vajikaram, Brahmanam. Hamsapadi Taila we use in Clibia due to the Medasavrta Vata and obstructive vascular erectile dysfunctions.
All the questions are completed, sir. Thank you so much. It's a very wonderful session by you, sir. We are very much thankful for sharing your valuable and very practicable knowledge. We are very happy for more of number are participated through YouTube also. We are very much happy for your presentations and practical it's not only the diagnosis you have been shared with us, it's treatment schedules and all the practical aspects you have shared with us. We are very much thankful to you, sir.
Hello. Hello. Hello.
Yes.
Sir, namaste.
Namaste.
I am very much thankful to Dr. Madhav. Thankful to Dr. Madhav Dikavi, sir, on behalf of our institution, department, each and everyone participant for his for sharing his wonderful knowledge. Not only it's a knowledge, it's an experience which was badly needed in present condition. Thank you, sir. Thank you very much on behalf of institution and department once again. And I extend my thanks to our beloved people who motivated to conduct such a program. Dr. K.C. Das, sir. Thank you, sir. Thank you very much. Thanks to our Roganidana department faculty, that is Vidyashree madam and Manjula madam for organizing smooth conduction of this program. Thanks to SVM family members. Thanks to each and everyone, those who are supported and guided for the smooth conduction of this program. Thanks to each and everyone. Thank you, one and all.
Hello. Dr. Dhruv, please close the session. Thank you so much, sir.